Madam Chair and colleagues, today I'm presenting AB 2540, the Community College Student Right to Access Act. I want to start by thanking the chair and the committee staff and stakeholders for their feedback and collaboration. AB 2540 will expand equitable access to medication abortion services for students attending community colleges across California. California has long made access to reproductive health care a core value, and this bill will move us closer to that goal by requiring community colleges that have existing student health centers to provide these services. While similar services already exist at the University of California and the California State University campuses, community college students currently face significant gaps in access to reproductive health care. And let me be clear, reproductive health care is essential health care, and access to this care should never be dependent on the type of college a student attends. It's past time for us to do right by all California students, no matter where they decide to attend. With the Community College Student Right to Access Act, we are closing a critical gap by ensuring that community college students, one of the most diverse and economically vulnerable populations in our state, have the same access to care as their peers at four-year institutions. This legislation would allow services to be provided specifically on college campuses that have existing health centers via telehealth or through contracted providers. It also improves transparency by requiring colleges to publish information about available services. I want to recognize the work of former Senator Connie Leyva, who championed Senate Bill 24, which ensured that UC and CSU campuses provide medication abortion services. It's because of her leadership and the strength of our advocates that we now have the momentum to expand access beyond just four-year institutions. With me testifying today is Alicia Nagpal, a Vice President of Legislative Affairs at the Student Senate for California Community Colleges, and Marge Plum, a nonprofit consultant supporting implementation of medication abortion services.
Good afternoon, Chair Bonta and members of this committee. My name is Alicia Nagpal, and I sit here as the Vice President of Legislative Affairs for the Student Senate for the CCCs, the official voice of 2.2 million students across California. I am not here just as a student leader, but as someone personally impacted by reproductive health challenges. Access to equitable healthcare also includes access to reproductive healthcare. It is necessary, and for many, it is life-saving. Students in remote areas such as the far north often do not have the same services as students in urban regions may have. Students who are struggling to meet ends meet may not have reliable healthcare, and that's what this bill resolves. AB 2540 is an effort to provide equity when it comes to reproductive health care to some of our most vulnerable populations. While students at the UC and CSU campuses already have access to medicated abortion through SB 24, community college students who are more likely to be low income, working, and place-bound often do not. With this discrepancy, students cannot access timely reproductive health care, and instead they are forced to miss class, delay their education, or perhaps even drop out entirely. Barriers to care become barriers to education. This bill would allow students to receive medicated abortion through their community college health center, making sure that even our most vulnerable students have access to what could be life-saving treatment. These are students who are our foster youth, immigrants, students of color, etc. Giving populations who are already disadvantaged the resources this provides expands on the equity work that should be strived in both healthcare and higher education. It means access to timely, affordable care without having to travel hours, miss work, or navigate complicated healthcare systems. It means privacy, dignity, and autonomy. It means that a student's zip code or institution does not and should not determine whether or not they can access basic healthcare. This bill also ensures thoughtful implementation, leveraging funding, supporting campuses, and requiring accountability through reporting. AB 2540 affirms a simple truth. Community college students deserve the same standard of care as any other student in the state of California. We respectfully urge your aye vote. Thank you.
Good evening, Chair and members. My name is Marge Plum, and I'm here in strong support of AB 2540. I previously directed the Solis Policy Institute at the Women's Foundation of California, where I worked with UC and CSU students and reproductive justice leaders to develop SB 24. I've since continued tracking and supporting its implementation on behalf of the Funders Collaborative. While the implementation of SB 24 is uneven in some places, UC and CSU campuses remain committed to providing this care. The campuses combined provided over 1,000 medication abortions a year for the past 2 years. This is below the minimum estimate of need, but California public universities are leaders throughout the nation, and I believe they are well positioned to address the remaining challenges. San Francisco State University shows what's possible. Their student health services presents medication abortion on their website and in literature as part of comprehensive routine care, integrated, confidential, and stigma-free. In 2025, they provided over 100 medication abortions, the highest in the CSU system, and is well on its way to meeting expected need. Students are accessing care on campus from providers they trust without unnecessary delays. This model works and should be expanded. At California community colleges, the need is significant, estimated at approximately 1,000 medication abortions each month throughout the system. Providing this care is simpler than ever. Medication abortion is safe, highly effective, and can be provided via telehealth without physical exam, ultrasound, or specialized equipment. Some community colleges are establishing billing through California's family planning program called Family Pact, and can easily add coverage through the state's presumptive eligibility for pregnant women program, making medication abortion free for all students who qualify. I respectfully urge your aye vote.
Thank you. Are there others in support who would like to offer a Me Too? Please come forward with your name, affiliation, and position on the bill.
Good evening, Madam Chair and members. Roxanne Gould, representing the American Nurses Association of California, in support.
Chair and members, Austin Webster with W Strategies on behalf of the California Nurse Midwives Association in support.
Deborah Bautista Zavala in support on behalf of the California Latinas for Reproductive Justice, and also in support by URGE, Unite for Reproductive and Gender Equity.
Chair and members, Kathy Mossberg on behalf of Essential Access Health in support.
Jennifer Robles with Health Access California in support.
Kimberly Robinson with Black Women for Wellness Action Project in strong support, also a co-sponsor.
Jason Henderson on behalf of the Faculty Association for California Community Colleges in strong support. Thank you.
Good evening, Chair and members. Keshav Kumar with Lighthouse Public Affairs on behalf of Reproductive Freedom for All and our over 400,000 members in the state of California in strong support. And as a co-sponsor.
Ryan Spencer on behalf of the American College of OBGYNs District 9 in support. Nailed it.
Kevin Guzman with the California Medical Association in support.
Thank you. Are there any primary witnesses in opposition who have registered opposition?
Good afternoon, Madam Chair and members. My name is Erin Azevedo. I am a student at UC Davis, and I am opposed to AB 2540. I was handing out pregnancy resource brochures on campus this fall, and a woman came up to me and whispered, "I am so glad you're here." I didn't know that this was here when I was younger. Then, gathering herself, said, "And I really wish I did." She then shared her story as a sexual assault survivor and how she felt abortion was the only option available. I'm here to say on behalf of her that this bill is not what the community needs, and it is an unnecessary expenditure of state funds. For my peers, there's no lack of access or awareness to abortion. It is available on campus, at clinics, via telehealth, and even by mail. Access to abortion is not a concern in the state of California. What should take priority is more affordable family housing, childcare without year-long wait lists, and referrals to medical care and support. I recently wrote a final paper on the resources available to pregnant and parenting students at UC Davis, and notably my professor, who was a parent during her own PhD program, was unaware of the many rights and supports available to her at the time. If even our faculty does not see that support, then it is clear that there are more pressing gaps in reproductive health care than access to abortion. 1 in 4 women in California receive inadequate prenatal care. At least 56 maternity wards have closed since 2012, half in just the past 3 years. Doctors are handling hundreds of births per year. The average OBGYN age is 51, with the most retiring by 59. Some rural counties have no OBGYNs at all. Maternal mortality has doubled, with the highest rates among Black and Native mothers. All this decline in care has happened while abortion has expanded. When we reduce the students' needs down to abortion access at the expense of every other kind of care, it is exploitive and reproductive coercion. It is unfair and out of touch with what students actually need to thrive. For these reasons, I respectfully ask for a no vote on AB 2540. Thank you.
Chair and members, my name is Leandra Wells with the California Family Council. I'm here today in opposition to AB 2540, which promotes and expands access to abortion drugs on community college campuses. I know what it feels like to face a pregnancy you were not prepared for. At 21, I was newly married in my last year of college and planning to intern in Washington, D.C. Then I discovered I was pregnant. I felt fear, uncertainty, and that my life as I knew was over. Yet with the support of my family, friends, and a local pregnancy center who gave me free care, I was able to finish my degree, embrace motherhood, and look, I have a good career. Many women who become pregnant in college feel overwhelmed, just as I once did. What they truly need is support, not a one-size-fits-all solution like abortion presented as a quick fix with lasting consequences. Abortion drugs are not safe. Research from the Charlotte Lozer Institute highlights patterns of emergency room visits and underreported complications. Likewise, the Ethics and Public Policy Center has called for stronger safeguards and better data transparency on the abortion pill. College campuses are not hospitals, and many students' health centers are not equipped to handle serious complications such as hemorrhage or infections. Expanding and promoting these services without immediate access to emergency care puts students at risk. Students deserve real support, real choices. Resources like pregnancy centers, adoption services, and safe surrender sites should be accessible and widely known so women are empowered to choose life. I completed my degree just 3 weeks after my son was born. Solely promoting abortion tells women they cannot succeed if they become mothers. But we all know women are capable of far more than that. For these reasons, we respectfully urge a no vote on AB 2540. Thank you.
Thank you. Are there others in the room who would like to offer an opposition? Me too. Name, affiliation.
Good evening. Andrew Martinez with the Community College League of California. The chief executive officers of California community colleges have shared a letter of concerns that's reflected in the analysis. And also, I'm speaking on behalf of the Health Service Association of California Community Colleges as well, which has also submitted a letter of opposition unless amended. And that also is reflected in the analysis as well. We want to thank the author and the sponsor for meeting with us to share with our concerns about implementation.
Thank you, sir.
Molly Sheehan with the California Catholic Conference in opposition. Thank you.
David Bolog, the SFE Alliance, in opposition.
Greg Burt, Vice President of the California Family Council, in opposition. Thanks.
Thank you. Seeing no other opposition, I will bring it back to the committee for any comments or questions. Assemblymember Aguirre Curry and then Assemblymember Ahrens. Addition of a co-author by the Majority Leader, Assemblymember Ahrens.
Thank you, Madam Chair. I want to thank the member from San Francisco for bringing up this really important piece of legislation and really highlighting the critical gap in healthcare coverage, that just because you're a community college student doesn't mean that you shouldn't have access to the same type of coverage as if you were a UC or a CSU student, and to sort of dispel the inaccurate statements that were mentioned previously by the opposition, how critical safe access to health care and abortion care is absolutely essential. And in other areas of the country where that's under attack, we've seen that there is no stopping abortion. You're stopping unsafe abortions, and you're causing more havoc, and you're causing dangerous procedures to happen, the likes of which we've seen many decades ago. And so we shouldn't be moving back. We should be moving forward in the state of California, offering health care to everyone. And that is exactly what this is. And it's not limiting or discouraging services provided to community college students. Before being elected, I was the president of a board of trustees for my community college in my community. When I was a student, we didn't have a food pantry. We have food pantries widely available now. We didn't have health care services. We have huge strides, and we need to go further. We didn't have bus and transportation passes. Many of our community colleges have them now. So you're pushing the envelope. You're saying that there are still gaps in coverage that we need. I want to thank the author for your bravery on making sure that accurate narratives are being presented when we're talking about healthcare coverage in the state of California. Be honored to be added as co-author.
Assemblymember Patterson.
Great. Thank you, Madam Chair. Well, it might come as no surprise I have a different opinion than my colleague, Mr. Ahrens. But I always think it's very interesting. I mean, I just perused a bunch of University of California Health Center websites and all this great information, that's provided on contraceptives, HIV prevention, pregnancy testing, and then also medication abortion services and all these other things. And then it's like referral for prenatal care. Am I like the only person in this room that thinks it's crazy that the University of California and other institutions and what we do in this building is focus on people who want to have an abortion? What about people who want to keep their babies? Like, I think we actually agree that there are a lot of expecting mothers who want and need help, and we should be helping them. And I think the UCs, honestly, it's shameful. All these health centers that exist that don't help these moms, these women that get pregnant on campus, and they have nowhere to go. And we will happily provide you with medication abortion, but hey, we will provide you with a referral to some clinician if you're lucky enough to have insurance to get it covered. I can't believe it. But that said, I have a question on the actual bill. I honestly want to know what this bill is solving, because right now you can call Planned Parenthood and get medication abortion sent directly to your doorstep. So, what gap is this? Why can't the community colleges or UCs or anybody else just give the phone number for Planned Parenthood?
Well, I've learned to pause when agitated, so I will let my witness answer that question.
Medication abortion can be handled through telemedicine. What we know about college students is that it's a new experience for them, being away from home, being on campus, and for them to be able to go to a student health center on campus that they've walked by will help them be able to navigate their questions, including, do they want to keep the pregnancy? Do they not want to keep the pregnancy? That's part of what happens in the UCs and CSUs now. There's pregnancy consultation with the students. For that student health center to then be able to call, if they don't have the medication on site, to be able to call another provider with the student is going to help that student tremendously. During the 4 years that I worked on SB 24, the parts that live with me are the student stories and how the idea of trying to figure out where to go, how to get there, whether to take time off class, whether are they going to have to pay for it? They don't, because that's not readily available, is just really impossible for them. I mean, I had students in tears telling their stories to the team and to myself, and how I had a student who was a volunteer at Planned Parenthood, and she's at one of the UCs. She went to the student health center. They gave her a mimeograph page of abortion providers. One was a crisis pregnancy center. Another one wasn't doing abortions anymore. She was a volunteer at Planned Parenthood, and Planned Parenthood wasn't on the list. And so she thought because the student health center gave her the list that she couldn't go to them. The student health centers have to be able to meet the student, help them access the care, provide the care themselves, in order to let our students be able to stay in class, to stay learning, to stay growing.
Well, I appreciate your answer. I mean, nothing stops the health centers from providing information or requiring them to do so, to provide the information to providers that have that, provide a referral just like they do for maternity services. But like, I'm just going to keep beating the drum. Look, I don't judge any woman who finds themselves in crisis and the decisions that they make. And I want to help every single woman that has an unplanned pregnancy. I think we have a major, major, major gap in this state for individuals that choose to keep their baby and find themselves in a situation where they don't know where to get help. I don't know if anybody even disagrees with me on that, but like, we need to do more, and I want to help them too. So thank you for answering the question.
Assemblymember Rogers.
Thank you so much, Chair. Probably not too surprisingly, I disagree with my colleague as well. And to answer his question about why are Democrats introducing so many bills that are on access to abortion, the answer is because you don't see Democrats introducing legislation to remove the ability for women to have children, but you do see Republicans introducing legislation to take away the ability for women to have abortions. That's why we focus on it.
Assemblymember Schiavo.
I would just add on that point that what has continuously confounded me on this political division around abortion is that on the other side of the aisle, people will fight and fight and fight against abortion, I think you're making very good points about supporting families, supporting parents, moms who want to have kids. I think you're making excellent points about that. But yet at the same time, Republicans are cutting health care for families. Republicans are cutting CalFresh and food subsidies for families and kids. Republicans are cutting the whole safety net that needs to be there to support kids and families. And so it just blows my mind that Republicans are so adamant that you need to have kids when the number one reason for abortion is because you can't afford to have that kid. And if we supported families more, if we had a stronger safety net, if we made it so that you could go to school and have a kid, which is what my stepdaughter did, but it's hard. It is hard. And it is something that I wish we could come together on, because I agree. We need to support moms. We need to have more of a safety net. But that is not our reality. And especially right now, as we are having hearings in our budget health subcommittee until 9:00 at night, talking about the disastrous cuts to healthcare that are happening right now, which is another reason why this bill is so important, because there are fewer places to go. You cannot just go to Planned Parenthood because they are closing clinics. They have been cut from the federal government budget on purpose, and you can't just go to Planned Parenthood anymore. So there should not be a difference for students, working class students, students who work, who are lower income typically in community colleges, should have the same access to medical abortion and health care that you have at a CSU or a UC. And that is simply what this bill does. It creates equity for students in our state at any of our public colleges and universities. And that's why I signed on as a co-author.
Assemblymember Gonzalez.
Respectfully, first I want to thank the author for bringing this up. I don't think any man should be telling a woman how to handle their reproductive freedom, and considering that they'll never have to carry the weight of making that decision. So I want to be very clear about that, and also confirm that Planned Parenthood does not just participate in abortions. They participate in testing, in general health screenings, breast cancer screenings, exams. They provide general health to most people. So I want to be very clear that when we talk about Planned Parenthood, it's not just about abortion, it's general health care. Thank you.
Assemblymember Caloza.
Thank you, Chair Bont. I feel like we're completing one thought here from the dais to support our colleague for bringing forward this important bill. Just to add on to what my colleagues already mentioned, it was through the leadership of the Speaker, the Pro Tem, the Governor, Assembly Democrats that put forth the emergency funding to put forth $90 million because Planned Parenthood sites were closing because they were targeted in H.R. 1. And it's because of Assembly Democrats that we are protecting this access to reproductive health care. And I just want to remind everyone here that when we were having those hearings that Chair Bonta led on H.R. 1 and the cuts and what they would do, I don't remember a single Republican colleague being here on the dais to listen to the testimony of what those cuts would do. And so respectfully disagree with everything that my colleague said. And I hope that next time you guys show up to the budget hearing, happily move the bill when appropriate.
Moved by Caloza. Seconded by Sharp Collins. Assemblymember, thank you for bringing forward this bill. I wanted to just clarify a couple of points made by the opposition and from the dais here. First, this proposal, should it become a bill, will actually be funded through independent sources, not through state funding. I think that's important to clarify. Because we have fully expended all of our resources already to be able to ensure that we are providing reproductive care for many individuals and abortion care. So we're thankful to be able to have that private resource in this moment or in time. Also just wanted to share and note that the analysis talks pretty significantly about the additional resources that are available in our community colleges and our CSUs and in our UCs that are around behavioral health, counseling, the other aspects of consideration that people will need to think through as they are making decisions about their reproductive care and their decisions around and family planning. So I think that's also an important piece just to be able to note. I also wanted to clarify that we also have the opportunity to make sure that we are supporting legislation like this because we have a legislative body, a majority that is willing to make sure that we are providing care for everybody. And I really appreciate that this is something that you are being very thoughtful about to make sure is available to every individual. I'll tell 3 quick stories. Sorry. First quick story. My mother went to community college in New York City, and because she wanted to be a student but couldn't afford childcare, I was handed from student friend to student friend every single day in order to be able to make sure that she could pursue her college degree. And I think that Assemblymember Shaivo's point about us not being willing to fully fund and support families in their care of their children is one of the foundational concerns that we need to address here in California. Second story is I, as a student, undergraduate, made a very important decision, transformative decision, very hard decision to have an abortion while I was in college. And I had the privilege of receiving care in my healthcare center on our student campus. In the state of California, in order to be able to participate in a UC or a CSU, you actually have to have insurance. So these are people who are already provided with insurance, and we'll cross our fingers and hope that that actually stays true. And my final story is that when I was in law school, I also had the ability to have full prenatal care provided and was able to give birth to a beautiful baby girl 6 weeks before I graduated from law school through the auspices of the healthcare system that was afforded to me in my university system. So I want to thank you, Assembly Member, for bringing forward an opportunity for us to be able to provide equity for every individual in the state of California through all of our college systems. This is a very necessary bill, and I want to thank you for your leadership. And now that you've perhaps had a moment to take a beat, I would ask that you close.
Thank you, Madam Chair, and thank you for sharing your lived experience with this and the fact that you had choices to make in those different times in your lives, and you made a choice that worked for you. And that's what I'm all about. That's what all the colleagues that have spoken out in support of this are about, is the choice to do whatever you need to do in that situation, whether it's have the baby, whether it's use medication abortion, whatever it is, it's about the choice. And I was joking when I said pausing when agitated, because nothing is going to stop me from doing everything I can to make certain that reproductive health care is available to every woman and every person that needs it, no matter where they attend their university, CSU, community college. It should be available to everyone. And I'd wish maybe the Assembly Member had been at my press conference yesterday, where he could have heard from the women and their lived experiences and what they've been through on their college campuses, and how Planned Parenthood was too far away, 2 hours away, with a heavy student load, working 2 to 3 jobs, trying to make ends meet. Student health care, reproductive health care needs to be made available conveniently, not just to UC students, not just to CSU students, but to our community college students as well. They are not second class, and I will not stand for it. So I respectfully ask for your aye vote.
We will clock that, Assembly Member Stephanie. We have a motion and a second. Please call the roll.
The motion is due pass to Higher Education Committee. Bonta.
Aye.
Bonta, aye. Chen. Addis. Aguirre-Curry. Aguirre-Curry, aye. Aarons. Aarons, aye. Caloza. Caloza, aye. Carrillo. Carrillo, aye. Gonzalez. Gonzalez, aye. Johnson. Johnson, no. Patel. Patel, aye. Patterson. Patterson, no. Rogers. Rogers, aye. Sanchez. Sanchez, no. Schiavo. Schiavo, aye. Sharp Collins. Sharp Collins, aye. Stephanie. Stephanie, aye.
That bill is out. Thank you very much, Assembly Member. We're going to move